Hello team, good morning. This is Dr. Vidya PT and I am the project lead too for this project kickoff meeting. As we are in the Mayo Clinic and we're going to present a new healthcare platform in the next mid of the 2026. We're going to start now project kickoff meeting on virtual pain management program. Those who don't know and who are in the entry level position, I just want to let you know about what is pain management program and what's virtually. Here, as we know about that, all we suffer from pain, right? Either it's going to be the acute pain or the chronic pain. In much concisely, what is meant by acute is that the acute pain is going to be the 3 weeks, the patient who suffer from the pain which cannot last from 3 weeks, it's going to be the acute. And the chronic, it's going to be the more than the 4 weeks, like the months, like the 1.5 months, like the 45 days, it's going to be the chronics. These virtual pain management program or the healthcare platform gonna provide the access to the chronic conditions like the rheumatoid arthralgia, fibromyalgia, like osteoarthritis and hip arthritis. Those who cannot come to the clinics because of the arthritis, they can have the virtual physical therapies and the virtual physical therapy exercises. They can drive through it and they can have access and they can relief from the pain through the exercises. That's what it is, and we're gonna create that for that, and we're gonna need more of the stakeholders for this virtual pain management program. We're gonna dive deep into that, and also not about the pain, about the chronic conditions like the arthritis I have told you before. It's also about the post-rehabilitation patients like the cardiovascular surgeries who underwent and the gastric surgeries, and they can access this platform too. These platform include a variety of from low level conditions to the higher level conditions. So I think these can access to your door-to-door steps like the elder populations too. So we're gonna dive deep into the platform, what we're gonna cover in this meeting. And just wait a minute. Yeah, what our project covers is like the company overview, and which is our company, the Mayo Clinic company, and it's going to cover the project overview and the goals, and the platform futures, which covers about what our platform is going to deliver to the individuals or the patients, and the who are our target users, as I told you before, and the benefits from what they can get, and the project scope and the phases. It also includes about the stakeholders and the roles and a timeline and the milestones, the communication and the risk plan and the budget overview. We have the Q&A at the end. You can write your questions in the paper or in the Teams. We can follow up those questions at the end of the meeting. We all know that the Mayo Clinic is a non-profit medical center which was founded in 1889. Which is the headquarters in Rochester. The Mayo Clinic offers a variety of from low level to the higher level patient specialties, like they also known for the patient-centered care, the research in medical education. They have different various specialties which can be included, like the cardiovascular and the post-rehab, post-surgeries and all those, and the inpatient and the outpatient too. They also have taken the initiatives, the digital health initiatives like the telehealth, the remote patient monitoring and the virtual care, which is a good thing. But as of now, they didn't cover about the physical therapy platform. Right now, we're going to discuss about that physical therapy healthcare platform, which going to discuss about the exercises and all those. And next, coming to the next slide, we're gonna why did we select this project to be implemented by the next year? As I told you before, the chronic pain affects millions of patients which have the limited access to the physical therapies and the pain specialties like the orthopedic specialty and the Yeah, as I told you before, it has the patients has the limited access to the physical therapy and the pain specialties, and which can be have the remote accessibility and the personal care for the patients. As we know about the Mayo Clinic motto, like the inspire hope and contribute to the um, health and well-being. When coming to the next one, just wait a minute. I'm sorry, guys. I'm just having a trouble with the slides. Just pause a minute. Sorry for the delay. Yeah. Next going to be the project vision and the goals. What are the project goals of this healthcare platform? Is the same like to improve the patient engagement and the outcomes. This may reduce the unnecessary clinic visit and healthcare costs, so that we can improve the access to the acute conditions. Whoever might not have the visits for their physical therapy, we can improve that access as well. So, what does the platform feature consist of? We are going to include these platform features in the healthcare platform of physical therapy, which is going to be the pain management program, which includes the virtual physical therapy exercises. In this virtual physical therapy exercises, these going to be included the specific conditions, depending on like if the patient is suffering from the OA knee, like the osteoarthritis of knee, there are specific exercises for the particular patients which are designed to them, and we can give those exercises to the patients login credentials. They can log in into that and they can practice to the those exercises. As we that's one example of that. And for the post rehabilitation patients like the CABG, so for those we can also give the particular designed protocol for them, like the weeks, like you have to cover the 1 to 2 weeks these exercises, and the and next following weeks you have to do these exercises. If they have any issues with the exercises, they can contact the virtual physical therapy practitioner. And and another platform feature we're gonna incorporate into that is it's gonna be the telehealth appointments with pain specialties. As I told you before, if the pain is into the orthopedic department, they're gonna consult into the orthopedician. If it is from the neurology department, they can consult into the neurology department. If it is from the cardiology department, they can consult the um, cardiologist, who is a physical therapist. And we also incorporating the pain tracking and symptom analytics, which include that if they suffer today, the pain would be like, as of example, from we do have the pain rating scale, right? If they suffer from 0 to 10, they'll note down today's pain. Like if they suffer from 8 as of now, today's pain, they're gonna include that 8 into that pain tracking, and they're gonna include the system. And the next day, the following day, after the exercises, how much the pain they are feeling. I'm sorry, guys. How much pain they are feeling, they're gonna track those two. So they'll have the graph like your pain is increasing or decreasing. So from these they can track their symptoms, the pain tracking, and they can have the personalized care plans, and they can have the educational modules which consist of the related articles. They can go through that and have the relevant experience. uh, um, these are the target users and the benefits. Our target users are going to be the patients who are suffering from 45 days and above, and the post-surgical patients who needs the rehab as well, and the remote patients. As we know about that, the remote patients cannot have access to the Wi-Fi or the mobile data. So we can explain them the exercises and log in into those exercises when they come to the visit for the physical therapy, and continue the same exercises in home. We are giving the opportunity Yeah, when coming to the benefits of the who are benefited from this um, platform is gonna be the they're gonna have the self management and continuous monitoring what they are doing right as of now. And what are the project scope and the phases? This project it's gonna be include the three phases: the phase one, the phase two, and the phase three. And the phase one, it's gonna be concentrated more on telehealth and the pain tracking. And the phase two, we're gonna concentrate more on the virtual physical therapy exercises and the education modules, as of we told you before about, which includes the articles which are published. We're gonna put into the education modules. They can have the access to those education modules. And phase three, it's gonna be the AI and assisted analytics and predictive recommendations. And when coming to the stakeholders and roles, we're gonna have the chief medical officer in these stakeholders, which is Dr. Anurag, and the IT system architect Michael, and the nursing supervisor Sumana, and the patient engagement specialist the Sarah, data analyst Jordan, the Sean, the training and education manager, and the James finance manager, and the Vidya, I am the physical therapist. Yeah, as you are attending the meeting, I hope everybody is listening to this who are attending. I know you have these roles and responsibilities as of now, and we're gonna have the bi-weekly team meetings. We're gonna upgrade about those updates about what you're gonna do in the future too. And as of now, we do have the chief medical officer, right? He gonna concentrate more on the results oriented and the medical terminology what we're gonna put into that healthcare platform. And IT system architect, they're gonna integrate Mr. Michael, you're gonna integrate more related to the software security and the integration of the healthcare platform. And you're gonna concentrate more on the HIPAA too. And Sumana, you are the nursing supervisor, right? You have to do the implementation stages and the realistic workflow examples which they can have access to. And the Sarah, patient engagement specialist, um, you should have the real world examples and the patient friendly language, like they're gonna not as a medical language, just as a patient friendly manners. Like if they want to raise in our medical terminology, it is called as flexion of the shoulder if they want to, but you have to explain in the patient friendly language, like you have to lift up the shoulder. Sarah, you're gonna do that. And the Jordan, you're gonna use the metrics and the analytic approach and the data visualization tableau, data visualization techniques and the graphs, like where they're gonna increase their pain and all those. You're gonna have the chart visualization. And the Sean, you're gonna educate the trainers about the how the platform is working like, and you have to explain in detail for every person. If they have any doubts, you have to clarify them. And the financial manager, who is James. James, you're gonna concentrate more on the resource distribution and how we're gonna implement in the phase 1, 2, and 3. I'm gonna make the protocol for various patients. And next, it's gonna be about the timeline and these milestones. We do have the kickoff meeting as of now, and the phase 1, phase 2, phase 3. Phase 1, we're gonna launch it the January 2026, and the phase 2, it's gonna be on the March 2026, and the phase 3, we're gonna launch it June 2026 as of now. We're gonna have the continuous evaluation and updates about it. And we do have we should take the updates about all those from the regulatory department to launch this product. And through communication through all the stakeholders, Mr. Sarah, the finance manager, the medical officer, and the physical therapist, we do have the weekly project team meetings, yeah, and the bi-weekly stakeholder updates. And you'll have the email and notifications on what you're gonna update. And we do have documentation stored. And what we're gonna have the risk and mitigations about that. We do have technical risk, compliance risk, and adoption risk, and the operational risk. as we are deep diving into the technical risk, the technical risks may include the integration issues like the regular testing and the IT support. The IT manager, you are responsible for this, and the compliance risk, which going to be the HIPAA. We should always make sure that the patient data is secured and the strict. We should follow the security protocols for this. And the adaptation risk, starting we may see the low patient engagement. For that, we're gonna do the education and the training campaigns in the different hospitals and the different locations and the public visiting places, and we're gonna improve this healthcare platform to the different to the next level through these training and education campaigns. And the operational risk, the staff availability should be available. I think for 24/7, we should have the clear schedule and the backup plans if it is necessary. Yeah, this is going to be the budget overview for the software development. I'm going to not reveal about the budget, but I'm just giving the X amount. And we should have the license for this telehealth platform. We should have the X amount of the budget, and for the staff training and the onboarding too, and the marketing and the patient outreach. And for the deliverables, we do have a full staff training for this launch, and the patient guides too. And we should have the patient guides as of now paper printed with how they can operate this healthcare platform, which will be useful for the elder population too. And the dashboard monitoring, as I told you before, we should have the dashboard monitoring for patient progress and the templates for clinical outcomes. The next steps following is we have assigned the phase 1 responsibilities. You should go through that. You will have the email for those of phase 1 responsibilities, and begin system development and testing. We'll do the schedule bi-weekly or weekly team meetings as necessary, and we should be prepared for training materials too. If you have any questions, I'm free to answer. We'll take a pause. Yeah, thank you guys for your time. You can contact my email if you do have any doubts. We can have the regular meetings as well in Teams. Thank you.